Hi, this is Veterinary Bites and we're looking at polyuria in nephrogenic diabetes insipidus. Any condition that stops the kidneys from responding to the antidiuretic hormone is termed nephrogenic diabetes insipidus. The balance of water is delicately controlled by ADH, which is released by the pituitary gland. When it binds with its V2 receptors and renal tubules, a series of cellular pathways are triggered that ultimately lead to the incorporation of aquaporin 2 water channels into cell membranes of the lumen. Water can then passively move out of the urine because of the high number of solutes in the renal medulla. Because this is a passive process, it relies on medullary hypertonicity, which has to be maintained actively by the kidneys. So, the effects of ADH depend on at least three things: binding to the receptors, activating cellular pathways, and the proper concentration gradients. If any of these three parts stop working, the kidneys cannot respond to ADH and diabetes insipidus will ensue. Exactly for this reason, secondary nephrogenic DI is very common, and it actually accounts for most cases of polyuria. This is because a lot of diseases can affect the kidney's ability to respond to ADH by interfering with at least one of these three parts. These include pyometra, pyelonephritis, hyperadrenocorticism, hypercalcemia, hepatic insufficiency, and many more. By definition, even diabetes mellitus is considered as nephrogenic diabetes insipidus, since the kidneys cannot respond to ADH because of all the extra glucose in the urine. On the other hand, primary nephrogenic DI is an extremely rare congenital disease in dogs and has never been reported in cats, so it is only really considered when other causes of polyuria have been ruled out.